How do doctors classify bladder cancer types? Imagine trying to understand a complex puzzle where each piece tells a part of the story about a tumor in the bladder. Doctors approach bladder cancer classification by examining how far the cancer has spread, what the cells look like under a microscope, and what type of cells they originate from. First, they look at how invasive the cancer is. If the cancer is limited to the inner lining of the bladder, called the urothelium or transitional epithelium, and hasn't grown into the muscle layer, it is called non-muscle invasive bladder cancer. These cancers are often caught early and tend to have a better outlook. They include stages like carcinoma in situ, which is a flat, high-grade lesion, or papillary tumors that grow outward in finger-like projections. Sometimes, the tumor has grown into the connective tissue beneath the lining but not into the muscle, known as stage T1. These are generally treated with local therapies and have a good chance of being managed successfully. On the other hand, if the cancer has penetrated into the muscle layer of the bladder wall, it is called muscle-invasive bladder cancer. This stage is more serious because the cancer is more aggressive and has a higher chance of spreading to other parts of the body. Treatment options often involve more intensive approaches, including surgery, chemotherapy, or radiation therapy. Next, doctors classify bladder cancer based on the type of cells from which it originates. The most common is urothelial carcinoma, also known as transitional cell carcinoma, making up about 90% of cases. It starts from the cells lining the bladder. Other types include squamous cell carcinoma, which can develop after chronic irritation or infection, and adenocarcinoma, which arises from glandular cells and is quite rare. There are also less common types like small cell carcinoma, each with different behaviors and treatment strategies. Another important aspect is grading the cancer based on how the cells look under a microscope. Low-grade bladder cancers have cells that resemble normal cells more closely. They tend to grow slowly and are less likely to invade the muscle or spread quickly. High-grade cancers, however, look very abnormal, grow more rapidly, and are more likely to invade deeper tissues and metastasize to other parts of the body. To get a complete picture, doctors use the TNM system, which describes the tumor size and extent T, whether nearby lymph nodes are involved N, and if the cancer has spread to distant organs M. The staging ranges from early, non-invasive stages to advanced stages where the cancer has spread far beyond the bladder. Finally, some bladder tumors grow outward in a papillary fashion, resembling small mushrooms, which are often seen in non-muscle invasive cases. Others, like carcinoma in situ, are flat and high-grade, indicating a more aggressive disease. In summary, doctors classify bladder cancer by looking at how deeply it has invaded the bladder wall, what type of cells it originates from, and how abnormal the cells appear. This detailed classification helps determine prognosis and guides the most appropriate treatment plan. If you or someone you know is dealing with bladder cancer, it's essential to consult healthcare professionals who can provide personalized advice based on these classifications.